Starting with our feet shoulders width apart, flat on the floor, pointing straight ahead in our Wuji posture. As we inhale, we'll allow the elbows to become heavy and the hands to become light, slowly floating up to the level of the navel. Turning the palms to face the earth, we'll exhale and bend the knees a few inches. Inhaling as we straighten back to our straight but not locked or soft knee position, and exhaling as we bend back down. The eyes are kept level on an imaginary horizon, focused on a spot on the wall about the size of a dime. The visualization here is that we are imagining ourselves as a giant water pump, moving water with each breath. After we have bent down, when we inhale, we're imagining that we're drawing water up from the earth through our legs and into the lower belly. And then as we exhale, we're shooting that water out our eyes and our fingertips through our focal point on the wall for hundreds of miles. Just as we are imagining pumping water, with each repetition, we are actually pumping blood up and out of the lower extremity. This exercise primarily works the quadriceps muscles, including rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis, as well as most of the hamstring muscles, especially biceps femoris's long head and both semitendinosus and membranosus. It also works the gluteal muscles, including gluteus maximus, gluteus medius, and gluteus minimus. Secondarily, it also works the anterior deltoid, biceps brachii, and both pronator teres and pronator quadratus in the forearm. Additionally, while this activity doesn't directly strengthen the psoas, flexing and extending the hip gently shortens and lengthens the psoas, which can be beneficial in patients with low back pain when the psoas is involved. This exercise is appropriate for patients dealing with leg weakness, whether that's from atrophy or neural inhibition. It's also appropriate for both knee and hip pain patients, as well as being appropriate for the post-op rehab of both knee and hip replacement surgeries. Additionally, it's an excellent exercise for patients struggling with balance issues and, as previously mentioned, low back pain patients. It's also a wonderful exercise for any patient dealing with reduced circulation in the lower extremity, such as patients dealing with congestive heart failure or diabetes. This would also be an appropriate exercise for patients suffering peripheral neuropathy. From a Chinese medical perspective, this exercise predominantly strengthens the kidney and stomach channels, as the kidney channel governs leg health and strength, and the stomach channel is the primary channel associated with the quadriceps group. However, it also affects the bladder channel due to both the gluteal muscle involvement and the hamstring muscle involvement, both because of its arm position and the deep abdominal breathing. It also affects the lung channel. From a TCM perspective, this exercise is mostly useful for kidney deficiency patterns, whether that's a yin or a yang deficiency. We see this pattern in conditions such as anxiety, patients suffering from night sweats or insomnia, low back pain, erectile dysfunction, and knee pain. This exercise is also useful for patients dealing with stomach yang deficiency and spleen qi deficiency. That makes it useful for patients dealing with indigestion, abdominal pain or bloating, a cold sensation in the abdomen, diarrhea or undigested food in the stools, as well as some patients dealing with GERD or IBS. I start patients off gently, doing just 5 or 10 repetitions 2 or 3 times a day, and gradually build as their stamina and strength improves. It is not unusual for patients to do 5 or even 10 minutes of this exercise at a time. When a patient is ready to end their session of springy legs, I have them exhale as they're bending down as usual, and then straighten the knees back to the soft knee position, envisioning they're standing up out of a pool of water. Once they're back in the soft knee position, they can allow their hands to slowly float down, just like they're moving through molasses, until they reach their sides back in the Wu Ji posture.